welcome everybody to this second webinar of the Committee on Bioethics, the DHBio, a webinar entitled Promoting Health Literacy in the Context of a Pandemic, Relevance and Challenges. This is organised by this committee, but it's done within the framework of the launch of the Strategic Action Plan of the committee, and it's being conducted under the auspices of the Greek presidency of the Committee of Ministers. Some words of introduction regarding the webinar, how it will unfold. The objective of the webinar is really to look at the meaning of health literacy and what it means in Europe, what's the relevance in Europe, to identify the challenges and to look, from a public health crisis perspective, how to communicate with the public to promote trust and respect for public health measures. And this may mean we discuss questions of reliability of information, how can the public discern information from unreliable information, and how to effectuate social responsibility and compliance. Some practical words regarding how this webinar will be done. It's being recorded and will be made soon available to you after the event. You can send in questions to an email address which we put on a green banner, which you should see on your screen now. So please send in your questions and we'll try to address them a little bit later. Now, before I come to Tessi Askan, who's going to give some words of introduction, after that we will have presentations by two invited experts. We have with us Dr. Leena Paakkari, who is a professor at the University of Jyväskylä, and she will talk about the meaning of health literacy and data in that respect in the context of COVID-19. We have with us, we hope, Professor Karine Lefeuvre, who is the acting president of the National Consultative Ethics Committee of France, who will also be looking at the French experience of COVID-19 in particular and issues regarding public communications. We also have on screen, we have three designated DHBio members who have agreed to join us and to be part of the discussion, and they will come into the open discussion element part after the presentations and pose questions. We have Assunta Moresi from Italy with us. We have Rodiga Grama from Moldova with us, and we have Konstantinos Velas from Cyprus with us. And they will be asking questions. We will also take in questions, written questions by email in between. On that, and without further ado, I'd like to pass the floor to Tessi Askan to start with her introductory words. Tessi, please.
Thank you, Lee. Yes, welcome to our committee's second webinar on human rights issues related to the COVID-19 pandemic. This webinar, as you heard, is about health literacy in the context of a pandemic. And last week, we learned about the many uncertainties around tests and test results. And we concluded, among other things, that the public may need to understand the shortcomings to make informed decisions on whether or not to take the tests and how to read the results. And likewise, they need to understand the reasons for instance, restrictive measures imposed by our governments or health authorities in order to trust and obey the directives given. In other words, we need health literacy to make good decisions. At the moment, there's a lot of information about different aspects of the COVID-19, both in traditional media and in social media circulating, and some of the information is contradictory, and in some cases there's mixed messages from authorities and mixed messages from health professionals. There's also scientific studies that seem to be pointing in different directions. So it's not easy for the general public to interpret and balance between all the reports. There's also groups that are isolated from both social media, but also digital platforms, which is now the easiest way of taking part in what's happening. And that makes it more difficult to follow news reports. And one such group is the elderly. But there's also groups with rooted distrust in authorities, or that have a different mother tongue, a different culture, and they may not know of or trust new findings that come out. So one question that I want to put forth is, how do we build their health literacy? As you know, our committee has recently published a guide to help to public debate, promoting a continuous dialogue with the public on bioethics issues. And the COVID-19 pandemic is a really good example and occasion when such dialogue is necessary. And another question is, at what point do we need to engage the public and how? And we have the strategic action plan, which we adopted quite recently. And there we have planned actions on promoting health literacy, especially for the elderly. But in the context of the pandemic, it's become quite clear that there are many other groups that are concerned. So a question that I'd like you to think about as a committee is, in light of this, do we need to promote health literacy also for other groups? So these are some of the questions that I hope that we may get answers to during this webinar. And with that, I'd like to extend a special warm welcome to our two guest speakers joining the webinar, Karine and Leena, and also to other representatives present to ask questions, and the rest of you listening. So I look forward to an interesting discussion and hand over back to our moderator, Lee.
Thank you, Tessie, for those words. I'm going to pass the floor straight to Leena Paakkari. You have 15 minutes, Leena, and just tell us when you want to start the slides. Thank you.
Yes, please, could you show the first slide, please? Can you hear me? Yes. Yes, the first slide, yes. So, dear Chair of the Committee on Bioethics and dear members of the committee, so thank you for inviting me to have a short presentation on health literacy and its relevance during the pandemic. During my talk, after an introduction, I will define health literacy and describe its core components as applied in the context of pandemic. Then I will show some findings on health literacy levels in different European countries. And finally, we'll raise some important perspectives for why health literacy of the people is now particularly topical and relevant. The emergence of COVID-19 showed that globally, both in developed and developing countries, health literacy is as important for the prevention of communicable diseases as it is for non-communicable diseases. And individual preparedness is key for solving complex real-life problems along with system preparedness. The rapid development of epidemic to pandemic forced countries and governments to adopt policies and give guidelines that required citizens to adapt their behavior at a fast pace and to decrease the spread of the virus and to protect their health. Similarly, people who were searching for the information they could easily understand and rely on faced a phenomenon that has been called as infodemic, an overabundance of information which, according to a representative of WHO, makes it hard for people to find trustworthy sources and reliable guidance when they need it. COVID-19 has underlined the importance of the health literacy. Next slide. The concept of health literacy has mainly been developed within two fields, healthcare and medicine, and public health and health promotion. Within healthcare and medicine, health literacy has mainly been understood as skills of reading, writing, and numeracy, often referred as functional literacy skills. Whereas in the field of public health and health promotion, a broader concept has been adopted to highlight other competencies than functional skills. One classical example of such a broader definition is that of WHO, according to which health literacy represents the cognitive and social skills which determine the motivation and ability of individuals to gain access to, understand, and use information in ways that promote and maintain good health. We could say that health literacy is a set of knowledge and skills that enable people to understand themselves, others, and the world. In addition, it refers to competencies that enable people to identify and modify the factors in their surroundings that constitute their own and others' health chances. And next slide, please. When brought into the context of COVID-19, this definition entails that people need theoretical knowledge on coronavirus, what it is, how it spreads, and what consequences it has on people and on society. They need health-related practical skills, that is, ability to take care of personal hygiene to avoid spread of the disease, to find information on coronavirus, to know where to go in case of being infected, and to follow the instructions given by the health authorities of government, to mention some. They need critical thinking skills that allow them to evaluate if the information on coronavirus is right or wrong, to critically compare information on coronavirus of various sources, and to make conclusions. They need self-awareness as an ability to reflect and identify the bodily signs of the symptoms that might indicate being affected, but also an ability to become aware of one's practices that might hinder or promote the spread of the virus. In addition, an ability to learn new required skills is an essential part of health literacy. In this context, it is fairly easy to agree with Alvin Toffler, who has said that the illiterate of 21st century will not be those who cannot read or write. It will be those who cannot learn, unlearn, and relearn. And finally, people need skills to become aware of the consequences of one's actions on others, to take responsible and ethical actions to promote health in surroundings, and to advocate on collective good. And next slide, please. During the pandemic, a concern of people's health literacy has increased. By far, we have only some comparative studies on population-level health literacy in Europe. And one of the few is that of Kristin Sørensen, Jürgen Belligan, and their colleagues that focused on measuring adults' health literacy level in 8 European countries. They found that almost every second respondent, that is 47.6% in the total sample, had limited general health literacy level, with the prevalence of, ranging from 28.7% in the Netherlands to more than 62.1% in Bulgaria. And the next slide, please. The health behavior in school-age children study, that is HBSC study, confirmed that the differences between the countries are prevalent also among adolescents. As the slide shows, when 6% of adolescents in Macedonia and 9% in Finland and Poland report low levels of health literacy, in Germany, Austria, and Czechia, the corresponding figures are from 16 to 18%. Similarly, we can see that when in Macedonia and Finland, close to 40% of the adolescents report high health literacy levels. In other countries, the proportion is half as smaller or even more. These findings are alarming during the pandemic, when people are expected to make evidence-informed and fairly rapid changes into their daily practices. All the health literacy competencies can be learned, but several of those take time to develop, which is a challenge when quick reactions are needed. And next slide, please. The sufficiency of one's health literacy depends on the expectations of the individuals and the complexity of the demands at hand, but also on the responsiveness on the systems. If, for instance, the information on coronavirus and related recommendations that individuals can access to are provided in different ways and by trusted sources, and in a manner that is easy to understand and that is actionable, it is more likely that more people have sufficient skills to understand the information in a way that was meant to, and to adapt their behavior based on the recommendations. Furthermore, if health literacy level of the people accessing the healthcare and other system is recognized and the services adopted to meet their competence level, it is more likely that people have sufficient skills to access and navigate in these systems and to receive required help and to behave according to the recommendations. As Christian Sørensen has said, health literacy is important when managing health and for interacting with healthcare services and social systems. In turn, services and organizations need to be designed in a health literacy-friendly way to enhance collective efforts and better health outcomes for individuals and society as a whole. And next slide. Thank you. We could say that health literacy is now more topical and relevant than ever. I will suggest 4 reasons for this. The first one, health literacy helps to handle infodemic. Abilities to think critically and to find reliable information on coronavirus secures genuine access to and power over the knowledge and knowing. However, for instance, among adolescents, we know that every 4th has difficulties in assessing the credibility of the information and comparing the information gained from different sources. And every 5th have difficulties in finding the health-related information that is easy for them to understand. Furthermore, the differences between the countries are clear. When, for instance, 32% of the adolescents in Germany report difficulties in assessing the information, if the information is right or wrong, the corresponding figure in Finland is 14%. Among adult population, the proportion who report having difficulties in judging if the information about illness in the media is reliable is close to 47%. Critical question is, do all people have an access to digital spaces where most of the information is offered? And do they have an access to free exchange of valid information? If not, have alternative strategies been offered to secure people's right to information? And next slide, please. Health literacy enables to take protective actions. This is the second perspective. Abilities to search for information on how to protect from becoming infected and to follow the recommendations are key, as is the ability to evaluate the risks and probabilities of certain behaviors. Health literacy supports learning of required skills and to adapt one's behavior and daily habits to meet the new demands. Clearly, the low levels of health literacy and particularly the mixing, complex, contradictory and difficult to be applied information and communication on the guidelines, regulations and coronavirus in general complicates individual sufficiency of health literacy skills to understand information and to follow, for instance, protective measures. Critical also is if the protective policies reach all people or not, and what alternative measures are offered. And next slide, please. 3. Health literacy enables timely access to healthcare. As health literacy covers skills of interpreting the bodily symptoms such as central symptoms of coronavirus and the skills to seek help and navigate in healthcare systems, to mention some, health literacy does support individuals' timely access to care. Importantly, many countries have offered helpline service for people where they can call and make sure if the healthcare is needed. And the next slide, please. 4. Health literacy promotes solidarity and prevents free riding. Efforts to decrease the spread of the virus and to protect health calls for joint actions. As an ability to think beyond one's personal interest, to assess the consequences of one's actions on others, and to participate in promoting collective good, highlights the role of health literacy in securing people's rights to health and the key priority to save lives. However, free riding as an irrational behavior in non-compliance with COVID-19 policies, which might be motivated by misperception of risks or other personal priorities, can become and has become evident in many countries. When free riders enjoy all the benefits of others complying with protective measures, thus creating a collective good of infection-free space and decreased infection risks, they themselves ignore, for instance, the pleas for following the guidelines. Free riding may be caused by the dilemma between the freedom to move and the government's responsibility to protect health of its citizens in severe cases like COVID-19. Health literacy doesn't guarantee solidarity or compliance with public health measures, but it does form an essential part of people's ability to make responsible decisions. It supports an adoption of such attitudes and motivation which may lead to socially responsible actions. However, equally important is that people have genuine possibilities to make such decisions and to take corresponding actions. Thank you.
Leena, thank you very, very much for that first presentation. It was very clear, very informative. It makes us see more clearly what's happening at the European level, the needs, the challenges, and some of the problems. So thank you very much for laying the groundwork for us. And of course, just to remind the audience that you can send in questions by email there's an address on the top of your screen on a green banner, so we can maybe address those questions later. And I'm going to come to Professor Karine Lefeuvre, who's with us. So welcome, Karine, acting president of the CCN of France. You have some slides, if we get those ready. I would give the floor to you, Karine. You have 15 minutes. Thank you.
Okay. Many thanks at all, and it's a pleasure to take part to this webinar. And many thanks for your invitation and organization. And I think we think that it's more than ever important to share at this moment. So effectively, it's a specific experience for me during this crisis COVID-19, because I took the lead of the CCNE, because maybe you know that Jean-François Delfrécy, the president of this CCNE, took the lead, also another lead of the Scientific Council. And we worked a lot during this time, and the link between health literacy and democracy are important. Next slide, please. Yes. To complete the talk of Leena, I would like to focus on 2 points. So health literacy in the context of crisis, and also a point of our experience in France about promoting health literacy with public consultations, especially during the États généraux de la bioéthique. I will explain you. Next slide, please. About the first point, health literacy in the context of crisis, you asked me several questions, and specifically the question of the key communication for public authorities in crisis context. And in our work in CCNE, we focus on different conditions. And in our different opinion, I will explain you after, 2 different key points appeared. So clarity, simplicity of communication, the question of accessibility, and it's very important to get and to give a transparency, communication with transparency. The key goal, so, is to trust the public ability, as Leena explained, and to give the opportunity to citizens to become actors of their health and of their life. During the crisis in France, but also I think it's a common public communication. The government appealed to the individual and collective responsibility, but the question of individual responsibility was very important, and it took a strong part in our communication. Next slide, please. So just to focus very quickly on our work during the work of the CCNE during the crisis, the commitment of this Council of Ethics was in a very specific context of state of health emergency, and the government in France, as in all countries, took some measures restricting public and individual freedoms, and the question between balance between liberty and constraints was in the heart of the debate. And it was very interesting to observe that the French National Council of Ethics was took a very specific place during this crisis, and because the government asked us, so we can suppose that it was a need of an ethical light before, during, maybe after taking a decision. So the place of ethics was very important during the decision-making progress. You can see two responses to the request from the Ministry of Health and Solidarity. We also had an opinion to respond to the request from the Scientific Council, and also there was an opinion to the National Digital Ethics Committee. And I can focus on the link between with health literacy. Next slides, please. As you can say, you can see different dates and the title of these different opinions, especially the first on contribution about ethical issues in the face of a pandemic, and the last one it's inverse, of the 20 Mai about ethical issues in déconfinement. So I think that in the words in the title of this opinion, in déconfinement, are very interesting. It's responsibility, solidarity, and trust. The question of responsibility and trust for citizens was very important. And next slides, please. For example, in our first opinion of the 13th March about ethical issues in the face of the pandemic, you can say that among our recommendation, we focused on the question of the creation of a joint body of scientific experts from different disciplines. And in this recommendation, we suggested to include the human and social sciences in conjunction with members of civil society. And it's very important to organize a part to include the society, to include people, to take part to the organization, to the decision-making progress. Finally, we can say at this time now that there is a lack of health democracy during this at this time in France, in these processes. Another recommendation was about the rapid preparation of independent feedback and assessments from all those involved in fighting the epidemic, and it includes also citizens. Next slides, please. As you can see in another opinion of the last one of the 2020 about ethical issues in déconfinement, we suggested 9 points of attention, and especially at the 5 and 7 points, the question of citizens' voice, and also the question of communication. And in this opinion, we focused on the, it was an appeal on an honest communication, and also an individual ethics of communication, because there were a lot of mismatches, especially in media, about this question. Next slide, please. In this opinion, among the different recommendations, you can find this one clearly justify the measures of constraints and create the conditions for the dialogue necessary to build confidence in civil society. This confidence in the civil society it's a really important point. It's the art of the policy, and it's a key for the next time. We have to improve this, to progress. Next slide, please. The second point, quickly, I wanted to focus on it's promoting health literacy with public consultation. I'm convinced, I'm not only in the CCNE, that the links between health literacy and health democracy are very narrow. Public awareness through the media must be combined with the implementation of debate tools. Yes, there are a lot of tools, different tools, but this link is important. And these tools allow the public to deepen the subject and participate in the debate. And to progress in health literacy, we have, I think, to progress also in the simplicity of communication. Next slide, please. Just focus on our experience in 1918 about concerning the public consultation on bioethics. It was a very important public consultation. That's the name in France is États généraux de la bioéthique. And you can see in French which word we would like for tomorrow. So it was an appeal, a question, very simple question, to ask all population on different topics on bioethics. Next slide, please. Yeah, just you can see the different steps to ask public consultation. So and it shows how the public debate and the public opinion could participate to the process, and that finally gave the parliamentary debate and a project of law. It's it's an actuality in France at this moment. Next slide, please. You can see the different steps between June and September, and in the first consultation report, you can find different opinion of these of the citizens included, and finally the opinion 129 of the CCNE. Next slide, please. On this slide, you can see the way between and the links between public actors, civil society, experts, and in different directions. It's a multipolar debate, and this multipolar debate can contribute and progress. It is a contribution to progress for health literacy and also for health democracy. Next slide. In 2019, there was a broad consultative process, and a key of communication and a key of tools. I think it's in the different tools. So website, citizens committee, regional havens, national havens, hearings, meetings with institutional ethics committees. There were very important. This was a very important time. Next slide. The communication through media is also important, and to include and to involve also there with population and to involve the population. That's why the population more and more is included in this process, and in France, we can say that at this time there is a laboratory of health literacy and health democracy also. Next slide. So it's just a slide with a different number with for example 270 events of mainlands and overseas territories. Yeah, you can see the very different way we choose to touch the public, to coach the public. Next slide. So the lessons learned, its outcomes of this consultation is and constitutes a collective property shared with French society, and to trust and to give population confidence, and you can see the link, the narrow link with the health literacy. So to permit that the population become actors, the scientific community have to participate to this communication. Next slide. Before I say that in France there is a laboratory of health democracy and different debate. Sometimes it's very strong with Gilets jaunes, and sometimes it's very interesting with a great national debate. And at this time, we just finished a very important public opinion about ecology with a convention sur le climat. So the climate big convention. They just participate and suggested a lot of recommendations to the government and to the parliament. Next slide. So, finally, trust the public's ability to tackle the complex problem after they have been sensitized to one or two issues through the media. I think with this sentence, it's very interesting to see the link with the trust, the confidence, and the media. So I began this talk with some words as transparency, clarity, simplicity. You can see how is it important. And next slide, please. For more information about our opinion, you can go on our websites. And I just want to conclude with the things that at this time we didn't at the CCNA write specific opinion about health literacy, but we work on the topics of health democracy. And as I repeat several times in my talk, I'm convinced that the links between health democracy and literacy are very, very narrow. Many thanks.
Okay. That zoomed-in approach to health democracy, health literacy in France, the efforts made to prepare for the pandemic, both before and during, the processes and procedures, the reflections, and also the importance of ethics in that whole process. So thank you for that. I think we've had a nice balance of presentations by Leena and by Karine in terms of setting the scene and looking at a particular country experience. Now we have the chance to come to our DHBio member designated delegates who are going to interact with the invited experts, and also I would invite you, of course, to send in your comments, your questions to the email address I mentioned beforehand. And we have approximately 50 minutes, well, 45 minutes together now to exchange. So I'm going to come to Assunta Modesti from Italy straight away. Assunta, would you give us your sort of feedback or what you're taking away and what's your question to the experts, please? Thank you.
And for this opportunity, do you hear me? So it's okay. So the first question is for Karine, because also I am a member of the National Committee of Bioethics, but our committee is Italian Bioethics, but our committee is different from yours in the structure, in the organization. And I have an observation and a question for you. The first is about the long tradition of the public debate in your tradition, in your French tradition. And because of your bioethic law, you must have a public debate. And so I've seen you have a lot of events that you can organize also at regional levels, but with a definite timeline. But I have a question. When I see your public debate and I think about our public debate, in your case, all the debate is organized from your committee, and it is following the way of the law, the parliamentary work. This is my impression. Don't you think that there is a risk of an up-bottom communication from experts to public, and only through with the filter of parliamentary debate? In Italy, the public debate is always from bottom, associations, civil society, and so on, very different people. From a certain point of view, it is a problem because we as institutional committee, our committee has no means, has no way to organize a lot of events. We cannot organize a lot of events. But in this way, we have more space to civil society. So my question, don't you think, what is your experience? Don't you think about the risk for an up-bottom debate from experts to citizens? This is, and then I have other questions especially for Leena, for the presentation of Leena. The first question is about, especially when you have spoken about essential health literature competencies and COVID-19, for instance, about critical thinking skills or health-related practical skills. How it is possible to talk about these topics in a context of such a wide uncertainty in the scientific knowledge about the new virus? And how is it possible to speak about common knowledge with such a variety of opinions among different experts? In Italy now, this is a big point of discussion in our public debate. You have different point of view if you speak as an epidemiologist or virologist or clinic or if you are an epidemiologist and so on and so on. So often citizens are confused because they are listening from different point of views. And so how is possible to speak about common knowledge? And then we need scientific communication when we speak about health literature. But this is a communication with a specialized language that needs to be simplified. Often we use testimonials from star systems, actors or sport people and so on. But in this, they simplify communication with simple slogans. So the concepts in a pandemic or health concepts are articulates, are not always in terms on-off. but often they simplify in terms on-off. And so, for instance, when you speak about a low viral load, this idea often is simplified with the idea that the virus is disappeared. And this is totally different from the concept of low viral load. But you need to explain and to articulate different concepts. So how can we balance simplification through testimonials and the necessary rigorous and articulate concepts? And the last questions, referring to the free riders in particular. Now in Italy, they are an issue, especially in what we call movida, about young people, and at the same time in the no-vax environment. And no masks movement is growing, also among informed people with relatively high educational degree. And so, do you have any ideas or suggestions in approaching them, in approaching this environment, possibly without penal sanction, because this doesn't work, the penal sanction do not work, but it's very difficult to speak, to have a relation, a verbal relation with these free rider environments. Thank you.
Assunta, thank you very much for those questions. I'm going to cut straight to Karine then to start with. Karine, do you want to respond? I'm going to try to make you very inclusive and to weave back in and out of different experts. So Karine, please.
I will. Thank you very much, Assunta, for your long question. This is a very interesting question you asked me, because you know that during the États généraux de la bioéthique in France, we had a lot of experience and events in link between the CCNE, so the National Ethics Committee, and our regional ethics committee. We have 14 regions in France. In each region, we have a specific ethical committee in link with the hospital. There is a law that provides this ethics committee, and at this time now, the French debate in the Parliament for our project of law of bioethics just began yesterday. At the beginning, there was an emergency, and now we began to have this reflection 2 years ago, and just at this time, we Finland Parliament will vote the law. And in this project of law, there is an article that says that the National Committee will have the mission to animate the public debates in France each year with, in now line, links with regional committees. So it's not also it's not only a debate through the action of the National Committee, but the links with a regional committee are very narrow. And during the crisis, the COVID-19 crisis, the links were and the role of regional committees was stronger, was reinforced, because in our first opinion during the crisis, we suggested to create some specific cellule de soutien éthique, so a specific support of ethics little council meeting to help professionals, and each regional ethical committee constitute their specific cellule, so meetings. And so the opinion and the expressive will of professionals, of patients and families, caregivers, conduct to a very strong reflection. And at this time, in the National Committee, we have a new reflection for the next opinion with this courses debate in regions.
Thank you, Karine. To simply cut back and forth to very quickly to Leena about the question about the uncertainty and different understandings of knowledge and different points of view. Could you respond briefly, Leena, to the question about Sunta?
Yeah. Yes, please. Yes. So the question about uncertainty and scientific knowledge. Yeah. I would quote Thomas Abel and David McQueen, who have stated that the best scientific knowledge on COVID-19 needs time to grow, and that as difficult as it may be, health experts themselves are challenged to help the public to accept uncertainty where it is a yet unavoidable fact. So critical thinking skills, we could say, enable people to accept the uncertainty after knowledge and knowing and the dynamic process of information development. And if people understand that the current measures are based on best available knowledge and the constant work is being done to gain deeper understanding of the coronavirus, it is more likely that they understand that information on coronavirus is susceptible to changes, as are the protective measures to be taken. That I would say here for the first question. And so theoretical knowledge is always evolving and thus dynamically changing. And so people need best available knowledge to support their decision making and modify their daily habits and daily practices to protect themselves, others, and the surrounding from infection. Then to the free riding issue. Well, let's show something that should be studied more to understand why people behave in the way they do. And this we don't know in the context of COVID-19 by far. So what are the reasons for the free riding behavior? And we know from the vaccination studies and that for instance, perhaps they have some sort of misperception of a risk of becoming infected, maybe one thing, and also because perception of one's freedom to make choices and to move, perhaps the awareness of these kind of rights may be other thing, but also perhaps the lack of abilities to think beyond one's personal perspective and to think about the consequences of one's thinking and behaving on others may be third thing that may also influence on this phenomena. So, but we need more studies. But vaccination studies has also raised up that to avoid free riding, the communication strategies should target social networks and social norms, but they have also raised that this is difficult to change norms and values. But also to emphasize the social benefit of reduced free ridings as compared to individual benefits, especially if, for instance, the vaccination rates are higher. So, but also to target all the subgroups. And also they have raised up the importance of involving NGOs and so the community or the civil community, civil society in planning and making the decisions regarding these different kinds of measures to be taken. And this could also reduce this free riding if people are feeling that their voices are heard and we are kind of understanding what are the reasons behind the behaviors. And so, yes, and then some have said that the focus on communicating refusal of some particular behavior may actually backfire, as then the latent message would be that such behavior is what many do, which may actually support adoption of unwanted behavior. So we could go deep into what have been done and studied by far in the context of vaccination and try to learn what has been found there as best practices. Yes.
Leena, thank you for being succinct. I think that covers Asunta's questions in general. So thank you to both. I'm going to cut straight to Karine, my colleague Karine now, who's going to give us a question coming in from email. You have the floor, Karine.
Thank you. So one of the biggest challenges to promoting health literacy is public defiance towards experts, and medical experts in particular, from a sizable share of public opinion, further spreads through social networks and certain news channels. We've seen it with vaccines for over 2 decades. We have seen it more recently during the COVID-19 crisis. What are the best ways, from your perspective, to address this defiance in order to promote health literacy?
That's a good question. Public defiance, reactions. Who wants to take that straight away? Does Karine's smiling? I don't see Leena, but I'll let you jump in quickly and briefly, if we may, please. Any takers?
Leena, you want to begin?
Perhaps. Well, it's but this was a tricky question, I think, because it was about what are the best practices to develop health literacy, but then again it was brought up that people are not perhaps believing what authorities are saying, but actually the development of health literacy is actually based on the assumption that we are empowering people to take care of their own health, to raise their own voice, to become aware of what they think and see is important, and perhaps even doubt what the authorities are saying. So the development of health literacy doesn't guarantee that the people are following the guidelines of the authorities, as we could see from one of the questions that actually the people having a high education actually select not to vaccinate their children, and that's the other thing. So what is the best way to target? Well, it depends. I would go into schools, because schools reach all the people at that particular age, and it's an educational institution with educational specialist teachers to teach health education and health literacy. And that has been highlighted as by WHO as a most influential platform to develop health literacy. And but the tricky thing during the COVID-19 is that the communication should be modified in a way that it challenged thinking. But now it's one-way directed and it's instructive in nature, so it doesn't necessarily challenge people's thinking and that kind of thing. So I would suggest first the schools.
Okay, thank you, Leena. Thank you very much for your insights. Karine, do you want to quickly give me one quick on this from a French point of view, briefly?
Maybe I think on two things, two elements. In France, we have the Parliament of Health. And that include a lot of associations of patients, and each year they write a specific report, including the issue of health literacy. And the last report was specifically focused on health literacy. I encourage you to read it. I don't know if they have an English version, but you can go. I can send you the link. It's only to explain that when during the COVID-19 crisis, it was also interesting to observe that the Association of Patients said, "Hey, we are here. Don't forget us, and don't forget the population, because we have to give testimony." And for example, in institution for elderly people, we observed that we didn't have time to ask people themselves and also family. And I think to answer this difficult question is that we don't have to forget that and to trust that people and association of patients must be included since the beginning in all discussion, all debate on decision-making process, and with this way, maybe they have a specific word, specific approach, but it can contribute to change the approach also of policy, new policy.
That's very interesting. Right, okay, thank you for that question coming in by email. Rodiger, Grammar, it's your turn, you have the floor. If you could limit your questions to perhaps one question and we can include more, can go back and forth, that would be great.
Yes.
Thank you.
Yes, I have only one question to both our speakers. So I would like to share your experiences about the practices which were applied in your countries in the COVID situation from the government. So how government influenced other stakeholders to promote right knowledge in population. In my country, for instance, this information was provided by health system or health workers, and we have a necessity to have a lot of stakeholders more to educate population. So in your countries, how government influenced other stakeholders to be in the same line and to promote health literacy in population?
Very good question. Thank you, Rodiger, for that question. Now, I mean, this is not exclusively only about, at the moment, about Karine and Leena. Of course, we have with us Tessie, we have Konstantinos with us too, in case you want to jump in at this point or a little bit later. Karine or Leena, do you have any reaction to that, how the government influences other stakeholders? Do you, in a few words, please?
Yes, just to say that during since the beginning of the crisis and in the context of emergency, I think that in France that was not the first step, the first priority in mind of the government, because of this balance of protection of this emergency and priority of to protect people, of course, and the safety and protect health. But at the second steps to make the projection for the next wave, maybe if it appears of COVID-19 or COVID another time, I think that the education of population and the contribution, as I said, of people involved will be included. At this time, it already began with the Ségur of the Santé, so a specific meeting with all actors of this crisis, and included associations of patients. And other the next public debates with population could contribute to for the following steps.
Thank you, Karine. Leena, do you want to quickly come in before we pass on, or not?
Just quickly. Finnish government made lots of collaboration with Finnish Institute for Health and Welfare, and that's a highly trusted health authority in Finland, as the government is trusted as well, and our president. And so all the NGOs, or at least most of the NGOs, or what that I know, actually followed the regulations and guidelines that the government gave. So all the guidelines were based on what all the guidelines that these different NGOs were giving were based on the governmental guidelines. So because of, I think, and the key here is the trust on the information that was provided, and because it was scientifically based, and yeah, this was basically how it was done. Yeah.
Thank you very much. Thank you. Okay, I'm going to switch now to our next. I hope that answers your question, Radhika, of course. We can always come back to it later. But let me pass now to Konstantinos Felas from Cyprus. Konstantinos, your question. We have an issue of time. I mean, we have another 15 minutes or so. We also need to say goodbye to Karine a little bit earlier than the end of the webinar, and invite her to give some comments. So your question, please, your first question. Thank you.
I have two very short questions, if I may. Thank you so much, Lee. My take-home message is that misinformation in general and limited health literacy more specifically are major obstacles to health. Therefore, my first question to Leena is the following. Research shows that what people actually do in the face of illness is often a logical extension of their personal beliefs rather than of the scientific standard. Would you please, dear Leena, comment on this finding and suggest what measures can individual healthcare providers take in order to correct misinformation, to improve health literacy, and ultimately to improve health? And my second very short question to Karine is, from your experience based on the French model regarding the public debate, what measures can you propose to public healthcare professionals in order to build and enhance partnerships with the communities they serve? Thank you, Lee.
Thank you, Konstantinos, for those succinct questions. Let me go straight to Leena. Leena, do you want to come reply straight away to Konstantinos, and then we go to Karine?
Yes. Yeah. Thank you for the question. It is true that people make health decisions based on personal preferences, experiences, values, and many other factors. And when I read through some research, the research shows that, for instance, shared decision-making with patients can increase their knowledge and commitment and making of informed choices, to mention some. And also tailored communication may be needed to secure that information provided is understood correctly. And then to avoid jargons, to avoid complex words, and so on. And to enable genuinely shared decision making but also to increase acceptability of the messages and to avoid too directive tone has been mentioned as some of the examples of these strategies that could be used. And I think within a few years period we know more about this, because under the umbrella of WHO European Health Information Initiative, the Action Network on Measuring Organizational Health Literacy will collect international data on healthcare responsiveness and provide the suggestions for policy and practice. And the data and quality of navigation, support, and quality of information community in healthcare systems. So then we know more about the system preparedness in many European countries, and we will get exact political guidelines and suggestions on this issue.
Thank you. And Karine, the question of the French model.
Thank you very much, Konstantinos, for your question. It's interesting because you asked about health professionals and how they could participate and they could be involved with the population actions. And I explained you that during this COVID-19 crisis, some health professionals took part in the specific cellule éthique de soutien, so support ethics meetings. And there will be a project of research about this action of this regional ethics committee, included a lot of health professionals and health and experience of these professionals to build a new ethics in France. That is we are really at a very interesting time. A new ethics, new ways to reinforce the ethics ethical reflection, in links with population, and how to include and how to interest all population, younger, older, all different situations at these issues. So I will talk to you about that maybe in several months, because I think we have luck to see this project of research. This is in work in progress, but I hope we will have little things to talk about.
Yeah, thank you. Thank you.
Okay, thank you. Now, Karine, you're going to be leaving in a few minutes. I know that. So before we run out the door, can I just ask you very quickly? In terms of your message for this,
I'm really sorry. I'm really sorry because the students are waiting for me. But 5 minutes.
Just one. You got 5 minutes, but just in case you run, what's your one takeaway? What's your one message to the DH Bio regarding what you've heard and what you're saying, please, very briefly.
I would like to say that it would be interesting to share different experience and different culture experience, because I think about the distance between population and approach of this crisis, approach of health stores, health issues, and I'm convinced that more and more the government and policy will include and will include population, and to include population, to ask population, hey, you have to be more actors of your life. At a time, maybe population will be more include themselves. I don't know if I'm clear, but I trust on this idea.
Karine, thank you very, very much for that. Right, we have another question incoming from email, so I'm going to pass the floor to Catherine very quickly. Thank you.
Maybe just very briefly to Karine Lefeuvre, before she's leaving, if you could explain very briefly what you meant by health democracy and how this relates actually to health literacy. Does it also mean that we need literacy in all dimensions of public policy? Economic literacy, security literacy, and is health literacy especially required because health is a particular casualty of democracy in general, or because it is more important in the current crisis? And can I maybe just add one more question, because I know there are so many interesting questions. I'm very sorry that I cannot address them all. Whilst public debate is useful for issues like health literacy, would it not be problematic when introducing obligatory measures such as lockdown and vaccinations? Would this not necessitate top-down approach and fostering of trust? Thank you.
Thank you very much. Who wants to go first?
In 2 words.
2 words. You got. Please go ahead quickly.
Just 2 words about health democracy. It's a principle of participation of the citizens, of the whole population. For a patient, for a man or a woman, for its one life, is a way of health way. It's also to take part to the discussions or to the decision making in, for example, in a regional or regional level, and it or also in hospital, for example, how patient could contribute to the functioning of this hospital or nursing home. This is health democracy. So it's for all population. It's at different level, and it's to contribute that the population become actors of his health. it's why the organization of all associations of patient is so important in France since many years, and the law and decrees are more or less precise and strong on this topic. And the link with health literacy is that to become actors, we need simplicity to understand and to be clear with all population. Just a little last example, in nursing home at this time, we had a lot of ethical questions with confinement, and we didn't take time to ask these residents. And we need now public debate, general public debate, to ask all people and also these people that are in different dependent level, but that who can express a lot of very interesting things. So we have to adapt our talks to choose the good words to be accessible, and the accessibility is a key word of this idea.
Karine, thank you very much. I know you have to leave now, so it really thanks very much for your time.
I have to leave. Thank you for all.
We'll see you soon. Of course.
Thank you.
It's very clear. Thank you very much. Now, Leena, can you come in and you have any thoughts on what's been said, the questions so far?
Could you remind me about the last question? What was it about health literacy and vaccination, and what was it?
If I may repeat, whilst public debate is useful for issues like health literacy, would it not be problematic when introducing obligatory measures, such as lockdown and vaccinations? Would this not necessitate top-down approach and fostering of trust, rather than public debate?
Well, I'm not sure actually what's this. Do you have any ideas what to think about this one?
Maybe I can ask the question to Tessie, because Tessie hasn't spoken yet. If you want to come in briefly on this point, because Tessie?
Yes, sure. Thank you. I think that there's not necessarily a conflict between the two. If you explain the reasoning behind a lockdown or some more drastic measures that you may take, and if you're able to give reasons for why you did so, and if you also build trust by being on par and online with health professionals and being able to give reasons like science and refer to what the lady pointed out earlier, the best knowledge you have, and be transparent about that we don't really know everything yet, but from what we know, this would be the best for us. And that would build trust and probably at the same time not necessarily disregard the possibility for public debate on the topic. But public debate is perhaps difficult at a stage where you're lacking information, and there's so many uncertainties on the topic itself. But as you pointed out, Leena, earlier, public debate needs to take place during a long course of time and be done in preparation for a situation such as the pandemic, rather than being on the spot done right now about a certain subject. I think that time will come when we have all the information needed to do an evaluation, looking back at all the information we had and the information that we will receive. That would be my comment to that question.
Yeah, then
Leena, do you want to jump in and complement that briefly? Thank you.
Just quickly, I think this was the one of the main ethical dilemmas is that governments are forced to take these quite strong protective measures to protect health of the populations, and the dilemma between this and individuals' freedom to move or to decide. But I do agree that if we are open and the decisions and arguments behind it, people kind of understand it. But this is also the case that if they lack health literacy skills in these cases, it's difficult for them to understand and perhaps even commit to these strong measures. But protection of health should be the key priority in all of these decisions, and sometimes these strong measures are needed.
Just going to. I changed the order of the speaking just to accommodate Karine's early departure. But I'm going to go back to Katrine now for one final question from email. And just by doing that, I want to cue Assunta and Rodiga and Konstantinos with any reflections towards the end now, because we're going to come to wrap up in a few minutes after, and your key messages, and therefore, and then finally to Tessie. So, first of all, Katrine, please.
My question from the email would be: we have heard about the role of civil society in public debate, but maybe complementary to that, what is the role of non-state actors in promoting health literacy? Maybe especially the role of INGOs in this context.
So international non-governmental organizations, NGOs, it has been touched upon, but I'm going to start with Leena maybe, and then I'm going to come to the other DHB members, please.
Yes, this was a good question that it came up now, because I forgot to mention it before, that though formal educational institutions like schools reach lots of people, and especially those who are in a school age, in the ages of 6 to 17 or something like that, these informal contexts and NGOs may actually reach lots of those population groups who are not school anymore, and who don't have, like, for instance, access to digital spaces. And this, the importance of NGOs has been highlighted in this context. And for instance, in the role of targeting or accessing all those vulnerable groups who cannot be reached through, for instance, through the digital spaces, because they lack access or technological resources that enable them to go into digital spaces. And for instance, sports clubs participation has been linked with better health literacy, and that's only one of the examples how these NGOs and other organizations or other informal, like, educational contexts can contribute to development of health literacy.
I can imagine that the culture of NGOs can be different in different countries. I'm going to pass the floor briefly now before. This is not really the wrap-up. We still have 1 or 2 minutes. So any reflections at this moment from Assunta, from Konstantinos, or from Rodiga regarding what's been said in general terms? You want to bring in any reflections here at this moment before we come to wrap up? Anything which strikes you as being important? Rodiga, please. Thank you.
Yes, I would like to mention only to add what Leena says, that it's very important to have state and not state stakeholders in promoting health literacy. And I would like to mention only a bad experience of my country, where church was not involved enough, as church is a really very powerful actor in our society. But speaking about right information of population, here we have a huge lack. So it's very important to establish this partnership between all stakeholders, which are very important in promoting the right information in population. Because now we have church as a source of fake news and misunderstanding of the situation, and this is a tragedy, actually. Thank you.
Thank you.
Asunda, please.
To accept uncertainty. I want to underline the idea from Leena to accept uncertainty. I think that this is a very good point, ethical point, because we are asking for a definitive answer, but we must know that now the knowledge is dynamical, as you said when you spoke before. So to accept the dynamical also of the uncertainty. Thank you.
Very good point. Very good point. Thank you, Assunta. Konstantinos, please, briefly.
Thank you, Lee. Thank you. What I take home with me is that health literacy is crucial for health. And I would say there are 4 key professional stakeholder groups that we must and need to bring together. And those are the healthcare organizations, the community-based partnerships, the cross-sector collaborations, and the individual providers. All 4 key professional stakeholder groups need to work alongside in order to maximize the health literacy we have been talking about the last an hour and a half. Thank you.
It's time to conclude, and I'm going to invite you all, and then finally to Tessie, to give your one message. I know some of you already mentioned them, but if you could reiterate your message that you take away, that you would like to convey to the DHBio in going forward. And I will start with Assunta, please, briefly. Thank you.
And I didn't understand the beginning of your phrase.
Your one message to convey to the DHBio in conclusion of this webinar.
Health literature is real fundamental, and these 2 webinars were very useful for us also to go in deeper in our plan, in our strategic plan, very concrete answer of our strategic plan in the context of COVID-19. So thank you to all the people that organized them.
Thank you. Thank you very much. Rodiger, can I come to you for your one message?
Yes, I would like to have after this webinar a strong position of the society as a result of good practices from different countries faced with COVID, about good partnership between all stakeholders in our societies, because this is the problem of my country, and this is why I need to know, and I would like to know more information, and I hope the partnership which should be provided in a society should be a key message of our committee cell.
Thank you. Your one message, Konstantinos, please. Thank you.
Thank you, Lee. I think in order to address this urgent problem, we need a strengthened commitment to health literacy by the healthcare professionals within and across organizations and down to each individual provider. Thank you.
Leena, did we give you your one message? Did we do that? Have you communicated that? Have you got anything, or shall I pass to Tessie?
I can say a few things quickly. So I agree that health literacy is needed of both people in need of the information and services and the individuals who provide them, and it's needed to prepare individuals for situations that require rapid reaction, social responsibility, and sense of solidarity. And sometimes there is no time to develop health literacy if quick changes are needed. And here, the sufficiency of existing health literacy level comes paramount. Thank you.
Excellent. So now, Tessie, you have the floor to conclude with some final remarks. You have 2 minutes. In which to do so. Thank you, Tessie. Thank you to all. Mute.
Tessie.
Unmute.
So I wanted to conclude. I had been. I'm not muted now, am I? Can you hear me?
Yes, you're fine.
Can you hear me? Yeah? Okay.
Yes.
So, I said thank you so much to all of you for a very fruitful discussion. Thank you for your key messages. I think you said everything so well and eloquently. I'm not sure what else I can do to wrap up, but I will try my best to to just underline some of the things that we have. I think that we can conclude this discussion with saying that low health literacy and misinformation in particular, but also not enough communication about the reasoning behind some constraint measures can be an obstacle and prevent individuals from making good decisions and from taking the right precautionary measures, not only for their own sake, but also for the collective good, as Leena pointed out in her presentation. So misinformation and lack of information can also create distrust in authorities and also in experts and the medical professionals, especially if there's mixed messages and they're not online with each other. The key messages from Karine, she mentioned that she thought it was important to share experiences afterwards, and that is truly something that we want to continue doing. We have a platform for doing so, so I urge you all to send in more information as the situation evolves. Also, I'm hoping to have much more discussions on this later on, and we will be able to have both share experiences but also assess the ethical aspects and human rights aspects of everything that comes down during the pandemic. Karine also, one thing that I wanted to underscore from her presentation was that she said, trust the public's ability to approach complex problems, that we should not underestimate the ability, but of course the information has to be there, and we have to explain, put all the information and be transparent about what we know and what we don't know, which brings me to one of the key messages that Leena put forth, that we need to accept uncertainty at this point and make clear that we're basing decisions on the best available knowledge. And Leena also pointed out that health literacy is best built in the form of preparedness for a situation like this or a pandemic over time and through education in school. And this is also something that we've been underlining in our guide to public debate. So I think it goes well hand in hand, and our guide is well worth promoting in that sense as well. So what more could the DH Bio do with regard to what we've now learned during these two webinars? During this specific webinar, I think that we may want to think about if we can develop our guidelines, for example. We have a guide on public debate, but do we specifically want to point out how to combat misinformation, how to try to avoid having free riders, how that is prevented, and perhaps also direct more, because now we spoke just a little bit about the healthcare professionals joining forces with the authorities, but I think that's a really important key message that we should try to deduce from these discussions, is that we need to, in order to build trust, we need to not only be open about what uncertainty there is, but embrace the information that we're receiving from the health professionals who are working on the floor and get get more knowledge from a day-to-day basis, and be sure to also communicate that to the public to build trust. And perhaps we could encourage, besides what is already in our public debate guide of bringing public debate from a young age, also perhaps organizing specific dialogue initiatives in relation to the COVID-19 pandemic eventually. So I think that this webinar shed light on the importance of acknowledging health literacy in the pandemic. And we have in the action plan, like I mentioned, an action to work towards health literacy for the elderly. But I think we need to think about how to embrace other groups, such as the free riders and other groups that we need to probably be more clear about how to approach them. And also, I think that we need to think about how to improve everybody's health literacy. And I think one thing that came up from Leena's presentation that I think was very interesting was that there's not a clear connection between the level of health literacy and the resources of the country or the size of the country in population and such. So I think it would be very interesting to explore and to follow what can come out of more studies on how you build a good health literacy in a country, because some of the countries who had a high health literacy may not be known for having a lot of resources. So this would be quite interesting to explore. Now, for your information, the Bureau will be meeting tomorrow and prepare some proposals for actions of high priority to meet the human rights issues raised by the pandemic. And this webinar, as well as the former one, will certainly have provided us with food for thought and good tools in this regard. So we will come back to you with some proposals shortly. So thank you. Over to you, Lee.
Well, thank you very much. We're a little bit over time. Thank you to all the speakers, to Leena, to Karine, to Konstantinos, to Rodiger, to Asunta, and to you, Tessie, for making this such a rich discussion with lots of questions. So thank you to all. Thank you to the attendees, to those we can't see, for staying with us. Thank you for your questions if you sent them in. That's the second webinar we've had now. They'll be both online very shortly, so you can consult them again and again and again. In the meantime, this webinar is closed, and thank you for your time, and see you soon. Thank you.
Thank you very much. Thank you, Lee. Thank you, Catherine. Thank you.
Bye-bye. Thank you. Thank you.